I don't know if you've ever like had a car accident and then you're amped up and a few hours later you're jittery and that adrenal, it's just up here. That's what you're doing to yourself when you're stressed about your ED and you're putting pressure on yourself to perform. You're actually making it harder for you're making it the opposite of harder. You're making it more difficult for yourself.
Yep.
Because you're not giving your body the opportunity to do what it's supposed to do.
Health, fitness, mindset, nutrition. Live better and longer. I'm Saad Alam, and let's hone in.
I don't know if you've ever like had a car accident and then you're amped up and a few hours later you're jittery and that adrenal, it's just up here. That's what you're doing to yourself when you're stressed about your ED and you're putting pressure on yourself to perform. You're actually making it harder for you're making it the opposite of harder. You're making it more difficult for yourself.
Yep.
Because you're not giving your body the opportunity to do what it's supposed to do.
So, big takeaway.
Yeah.
Take a deep breath beforehand. Just let it happen.
Yeah.
What are the medications guys are using? And here's the reality. We know Viagra, we know Cialis, but can you kind of give us the hierarchy of the medications and when you decide to pull each one out?
Yeah. Well, and also testosterone too, which is really important to discuss. Because what I tell people, so if you think about Viagra and Cialis, what they let's talk about how you get an erection, right? There's blood flow into the penis through the blood vessels on the penis. And then the blood doesn't leave, right? So the blood goes in, the blood stays there, usually until after ejaculation, and the blood goes back.
Can I ask you a question?
Yes.
How does it know to stay there?
That's a good question, and I don't exactly 100% know, but it knows.
I was going to say, it
knows.
It's like perfectly timed. It's just like you're there, and then all of a sudden it's like...
Penises are brilliant. They're very good at their job, generally. I know, I said it. Penises are very intellectual organs, and they know what they're supposed to do when they're supposed to do it, right? They know if they're supposed to urinate. They know if they're supposed to ejaculate. They know if they're supposed to be erect. They know when they need to pull their testicles up to the body or drop them lower. They're intellectual organs. So the PDE5 inhibitors, which is the Viagra, the Cialis, the Levitra, they work on the function of the penis itself.
Yep.
For example, if you have diabetes or high cholesterol and you have plaque in the blood vessels and blood can't get in and out properly, they dilate the blood vessels and relax the blood vessels to allow the blood to go where it needs to go. But what I tell people is testosterone is like having a fully functioning car with no gas in the tank, which means the blood vessels work fine. You don't have high blood pressure. You don't have high cholesterol. You don't have diabetes. You have no hardening of the blood vessels, which is different than hardening of the penis, right? Because if you have hardening of the blood vessels, you don't get hardening of the penis.
So hold on. I just want to make sure we understand that. So if you have hardening of the blood vessels, it means that the blood vessels are not willing to expand to let the blood go into it.
To let the flow. So it's almost like putting your finger over a garden hose. And it kind of cuts off the flow and you don't get as much blood flow, right? So testosterone is really important because it's like having a car that's 100% functional but has no gas in the tank. And you can throw Viagra, Cialis, Levitra. You can give people all of those, combo pills, compounded pills. You can do it all. But if you don't have enough testosterone or you have low to no testosterone, you will have a much lower success rate because you do need to have gas in the car.